safety of both individuals and the environment. Here are some tips and tricks to help you store and dispose of medications properly. Storing medications. 1. Read the instructions. Always follow the storage instructions provided by the pharmacist or mentioned on the medication label. Some medications may require specific storage conditions such as refrigeration or protection from light. 2. Choose the right location. Store medications in a cool, dry place, away from direct sunlight, heat, and moisture. Bathrooms and kitchens are generally not ideal storage locations due to the humidity and temperature fluctuations. 3. Childproof containers. Keep medications in childproof containers and store them out of the reach of children. Consider using high shelves or locked cabinets. 4. Original packaging. It's best to keep medications in their original packaging to retain important information such as dosage instructions, expiration dates, and lot numbers. 5. Avoid pill organizers for certain medications. Some medications, especially those that are sensitive to light, air, or moisture, may not be suitable for long-term storage in pill organizers. Check with your pharmacist if you're unsure. 6. Refrigeration. If a medication requires refrigeration, store it in the refrigerator away from food items. Some medications may need to be kept at a specific temperature, so check the instructions for guidance. 7. Separate storage. Keep different medications separate to prevent cross-contamination. This is especially important for liquid medications that can easily spill or leak. Disposing of medications. 1. Check the instructions. Some medications come with specific disposal instructions. Read the medication packaging or consult your pharmacist to determine the recommended disposal method. 2. Take-back programs. Check if your local pharmacy or healthcare facility has a medication take-back program. These programs allow you to return unused or expired medications for safe disposal. 3. Do not flush down the toilet or sink. In general, it is not recommended to flush medications down the toilet or sink. This can contaminate water sources and harm the environment. 4. Remove personal information. Before disposing of medication packaging, ensure you remove or obliterate any personal information to protect your privacy. 5. Mix with undesirable substances. To prevent accidental ingestion, you can mix solid medications, pills or tablets, with an undesirable substance like kitty litter, dirt, or coffee grounds in a sealed bag before disposing of them in the trash. 6. Sharps disposal. If you have needles, syringes, or other sharps, use a designated sharps container to dispose of them. Do not place sharps directly into the trash or recycling bin. Remember, if you have any specific questions or concerns about storing or disposing of a particular medication, consult your healthcare provider or pharmacist for guidance. Ways of storing and dispose of expired medicines. When it comes to storing and disposing of expired medicines, it's important to prioritize safety and environmental responsibility. Here are some recommended ways to handle expired medicines. 1. Read the labels. Carefully read the packaging and labels of expired medicines to understand if there are any specific instructions for disposal. Some medications, especially those that can be harmful or controlled substances, may have specific disposal guidelines provided by the manufacturer or local regulations. 2. Check community programs. Inquire with your local pharmacy, hospital, or health department about community programs that facilitate safe disposal of expired medicines. Many areas have take-back programs or designated drop-off locations where you can dispose of medications properly. 3. Drug take-back events. Keep an eye out for drug take-back events organized by local authorities or healthcare organizations. These events provide an opportunity for individuals to safely dispose of their expired medicines. Check with your local community centers, pharmacies, or government websites for information on upcoming events. 4. Pharmacy drop-off. Some pharmacies have drug disposal programs that allow you to bring in expired medications for proper disposal. Contact your local pharmacy to inquire whether they provide such services and whether there are any specific requirements for disposal. 5. Household waste. If you cannot find a take-back program or drop-off location, you can dispose of most expired medicines in your household trash. However, it's important to take some precautions. First, remove any personal information from the packaging to protect your privacy. Next, consider mixing the medication with an undesirable substance, such as coffee grounds or kitty litter, in a sealed bag or container before placing it in the trash. This helps discourage accidental consumption or misuse. Finally, check your local regulations to ensure there are no specific instructions for medication disposal in your area. 6. Flushing as a last resort. In some cases, when there are no other options available and there is a potential for misuse or harm, the FDA advises flushing certain medications down the toilet or sink. However, this should be considered a last resort and should be done only if specifically instructed by the medication's label or by your healthcare provider. Flushing should not be a common method of disposal due to potential environmental impact. Remember, it's always best to consult with your pharmacist, healthcare provider, or local authorities for specific guidance on the proper disposal of expired medications.